specific steps do hospitals typically have in place to prevent wrong patient surgery, and where do those systems fail?
Sure, that's a great question. It's interesting, actually. All across the country, the hospitals follow these same steps. It's called a universal protocol because it's universal across the country. What those steps are is first, when the patient first comes in, the surgical team will perform what's called the preoperative verification process. This is where they ask you to tell them your name, your date of birth, and then they'll cross-reference your medical record number. A lot of times when you're in for a procedure, you'll have a bracelet on. That bracelet might scan, or they can check the number. Then they repeat these steps multiple times before the procedure actually begins, up until right before the procedure, they do what's called a timeout, and everyone stops. And everyone on the surgical team is part of the timeout. And again, verify the patient's name, the person's date of birth, and their medical record number to ensure that they have the right patient on the table in front of them. The way this breaks down in a wrong patient surgery can be miscommunications between the team, or even just rushed or sloppiness among the team members, or it can happen at handoffs if the patient's being brought from another part of the hospital and being handed off, or if they're handing off in between shifts, or a lot of times when we see communications break down and patients being misidentified. The other thing is, if these steps, even though they're universal, if people are rushing or being sloppy, can skip these steps, or um, only do one of the timeouts or preoperative verifications instead of making sure that you have the right patient at every step along the way.
Is one of the places where it can break down, like after the person is maybe put to sleep or something like that, in preparation for a surgery, they're no longer conscious to be able to answer a question like, what's your name, what's your date of birth, and something like that.
Yes, you'll absolutely see that. And again, that goes back to skipping steps, that they didn't perform these checks and go through their checklist before they put the patient under. Now the patient's under and they can't do it the right way. They can't involve the patient in that process like they're supposed to.
In a wrong patient surgery case, what evidence is the most crucial in order to establish negligence on part of the hospital staff?
A lot of important evidence that can explain what happened, how something so obvious could occur. Number one, first and foremost, that's going to be the patient's medical records, but not just what the medical records say now. It's important to get the metadata behind those records to see what was changed and when. Did anyone go in after the surgery and make changes to that patient's record? It's also important to get the hospital's policies and procedures. Did they put these universal protocols in writing, in place, and implement them among their surgery teams? It was also important to get the schedules. How busy was the operating room that day? How many procedures was that surgeon performing before and after that one? And then you're going to get the witness testimony. Everyone who's in the room. What did they see? What happened? How did this occur? And then finally, you'll need expert testimony to explain what was supposed to happen and what wasn't followed here.
Beyond just the surgeon themselves, what other medical professionals like nurses or anesthesiologists could be held liable in a wrong patient surgery lawsuit? And is it those individuals that are held liable, or is it just the hospital as a whole?
Sure, that's a great question. I mean, it's both. It's first and foremost, you hear that, surgery especially is a team effort. It ultimately comes down to the surgeon as the captain of the ship, but he has an entire team, each of which has its own role and responsibility, as well as a responsibility to speak up if something's not being followed, or something hasn't been done, or something's been skipped. And that could be the surgical nurses, that could be the scrubs, that could be the techs, that could be a physician's assistant, that could be the anesthesiology team, the anesthesiologist and the nurse anesthetist. All of them are working together and equally responsible. But as you pointed out, it also comes down to the hospital and its administration. Did they have the proper policies and procedures in place? Did they implement them? Did they orient team members on them? Especially now, we see travel nurses are big. We see people floating to different parts of the hospital. Are they properly oriented on the policies and procedures in this operating room? And are they held accountable? Is compliance enforced?
What is the concept of informed consent, and how does that play a role in wrong patient surgery cases?
Yeah, so what's important to understand about informed consent is that it is not a piece of paper. It is not a waiver that is just signed. Informed consent is a conversation between the patient and their doctor about what is this procedure? Why are we doing this procedure? How is the procedure performed? What are we hoping to get from this procedure? What are the risks and benefits and possible complications? If you don't have all that, you don't have informed consent, regardless of whether or not the patient's signature is on a piece of paper or on some consent form. And so in a wrong patient surgery, this is obvious because you never have that patient's signature for the procedure that was performed.
How is that documented? You're talking about like this is a conversation between a patient and a doctor or a hospital system, and is there any way in which those conversations are documented?
Yes, that conversation absolutely needs to be reflected in the patient's medical record. And again, that's not just this consent form with the signature on it and just what the doctor or an assistant wrote on that consent form. It needs to also separately be documented in the patient's medical record that this conversation occurred. Here's what we talked about. Here's the questions the patient asked and how they were answered. That documentation needs to be present to make a record that there was this informed consent process. And in fact, hospitals have policies and procedures on just how medical professionals should need to go about obtaining that informed consent. Again, it's not just a simple piece of paper with a signature.
Do hospitals ever or doctors ever, record conversations with a patient, and keep a like an audio recording of a conversation, or is that something that could happen in the future?
That's certainly something that could happen. That also, right now, it goes medical provider to medical provider how they do their own dictation of their notes. Some prefer to type it out. Some will speak into a microphone that then translates that into the medical record, and certainly the patient can be a part of that dictation.
What are the typical damages that are sought in wrong patient surgery lawsuits, and how are those damages calculated, especially considering the psychological trauma that I'm sure would happen in the case of, having a surgery being performed on you when you weren't the one who wanted that surgery?
Yeah, so there's three types of damages in Ohio that you can recover for wrong patient surgery. That's going to be economic, non-economic, and punitive. Economic damages is anything that you can have a receipt for or can put a dollar value to. So that could be the cost of the surgery. That could be the cost of subsequent surgeries you need to correct having the surgery you were never supposed to have. That could be the cost of medical treatment or medicine that you now need because this surgery was performed on you. It could be assistive devices you now need, such as a wheelchair or a walker. It could be help that you now need around the house, such as a nurse or an aide. These types of things, we know how much they cost. We can calculate that and we add them all up and how much you'll need for the rest of your life, and that gives you the amount of economic damages. Non-economic damages are, of course, much harder to calculate because we can't put a dollar on it. This is the pain and suffering that you went through. This is the trauma of waking up from a surgery to find out something wasn't supposed to be performed. It's the breach in trust of medical providers who put you under general anesthesia only to have you wake up to find something totally different happened. And then those amounts are ultimately going to be calculated by a jury based on their life experiences and what value they place on that. It's also important to know that in Ohio, the amount you can recover for non-economic damages is limited by the Ohio legislature. The amount that it's limited depends on certain factors in the case, such as whether or not there's a separate loss of consortium claim for your family and for the loss they've suffered for your losses, and whether or not you have permanent and substantial disfigurement or can no longer care for yourself independently. Each of these factors raises the limit that you can recover for non-economic damages in Ohio. And then finally, you have punitive damages. Punitive damages may be recoverable if certain factors or facts are present in the case. The two big ones for this type of lawsuit would be either that someone, whether it be at the hospital or medical provider, went in and changed the medical record after the fact to try and hide what happened to avoid liability, or whether their actions showed a conscious disregard for the rights and safety of the patient. If either of those two things are present, then the jury may award punitive damages.